Hi, this lesson will be going over Chapter 3 from your Jansen book, which is essentially how it is that we use the multi-level policy and advocacy framework. So let's just hop right into it. When we work in our policies, when we're trying to discover policies that we want to change, we need to be prepared for some of the challenges that we will be up against and some of the tasks that we will have to do in addressing and figuring out what our policy changes are going to be. So, first off, we look at our 8 challenges. And I want to show you this slide because I think this will help it make a little bit more sense, especially because what we have going on here is that these different challenges will cut across the micro policy advocacy, the meso policy advocacy, and the macro policy advocacy. You will have to go through each of these challenges in each of these levels. Your first challenge, of course, is deciding whether or not to proceed. That should be based on what we covered in Chapter 2. Ethics-based first, evidence-based practice, and then is it feasible? Then you need to focus on decide on where to focus. So this will be looking at, well, which sector are you looking at, and what particular problem are you focusing on? Once you've figured that out, you've defined your problem well, you start to secure attention. You get people aware that there's a problem here, that it's policy related, and that we need to start looking at some change. You move on to step 4, which would be analyzing and diagnosing the problem, looking to see how big of a problem is it, how extensive does the policy reach, for how many people is this really a problem. Then you need to start looking at, well, let's develop a strategy and a proposal. How can we propose something different? What would be better than what we currently have? Then you've got to get the support that you need in order to make things happen. You don't do it in a vacuum. You have to get other people to support you. And then you implement the strategy or the policy and see if it worked. That's challenge 8, see if it worked. So that's a quick, dirty little description of how it is that we start putting together this policy and advocacy framework. There are a couple of skills that you need to keep in mind as you go through these different frameworks. These skills would be undertaken at any point in the work, whether it's a micro level, meso level, or macro level policy intervention. These skills are going to come into play. So value clarifying skills starts off with, well, how well can you define your values, and how well can you understand when people's arguments are coming from their own values? How can you make sure that you understand where they're coming from and where you're coming from? So to help illustrate this, I was recently on a trip to Peru, and in that trip we were with a bunch of students, and some of the students had gotten to an argument over patriotism. One student was an atheist and an ardent anti-patriotism type, and she argued that it was a shame that the Spanish came in and destroyed all of this great Peruvian culture, but that she wasn't afraid or didn't really have any problems necessarily with, say, burning an American flag. Now, of course, this is to make her sound like she's evil. She's actually the good person in this one. She got into an argument with someone else who was saying, that's such hypocrisy that there's, that you're not willing to, you're willing to say that it's okay to burn American flags and American symbols, but it's not okay to burn, ancient Incan symbols and their symbology. And what we had to do is talk about, well, what we're really dealing with are these different sets of values. There is a set of values that says, it's important for the group that is not in power to be re-empowered, and that's one value that the atheist had. And then there's another issue about how do we recognize symbols, and what symbols are most valuable to which person. And by discussing that with these two students, we were able to help minimize the fight that was going on between them. Political or influential skills. So basically, this is your ability to be able to get up and talk to people and be able to make them listen to what you have to say and actually even get them to follow you around. So this is the power of ideas and your ability to communicate your ideas. It's very important that you know how to do this. I'm going to post a couple of TED Talks here on how you can talk so that people will want to listen, as well as what is the meaning of power and how you use that. So those are very important skills you would use all throughout your process. Analytical skills, how well can you analyze and figure out what is really at the core, or what are the data trends and where is all of that going. And your interactional skills, which goes into how well can you just get along with people. In social work, you're expected to get along with a lot of people from a lot of different backgrounds. And so being able to use all of those skills effectively are going to be key in helping move your policy project along. So let's give you guys a quick example. We're going to go through what are some of the core problems in acute care hospitals, and we're going to go through the 7 different core problems and see how what we have are some of the problematic risks that would be involved in each of the different core problem areas. So acute care hospitals, this is essentially just about any hospital. Most hospitals are acute care. So some of the ethical rights that might be at risk for people who are going into acute care hospitals is one, is there informed consent around medical intervention? Now, the difference between informed consent and signing a form is just that. Certainly, a lot of people go into hospitals and they have to sign medical consent forms. But do they really know what that means? Do they really understand what is going on there? So is informed consent actually being recognized? Second is accurate medical information given. Do clients come in and do they understand the risks, the diagnosis, the prognosis, and are they included in the treatment planning that goes along with whatever services they might be receiving at the acute care hospital? Is confidential medical information given? Is there information being kept confidential? Are advanced directives being offered? And are those advanced directives being honored? Advanced directives are end-of-life care decisions that should be put into place before someone gets to the point where they lose their ability to make their own medical decisions, which goes along with the next one, their competence to make medical decisions. Okay, core problem 2, quality of care. Same, acute care hospital. Patients' quality of care may be at risk in the following areas. Is there a lack of evidence-based healthcare? Are they actually getting the best healthcare that is out there? Or is it based on a lot of medical mythology? There is still medical mythology. One of the most popular ones, 8 glasses of water a day. Totally a myth. You don't need 8 glasses of water a day. Most of the water that you need comes from your food. And your body tells you when you're thirsty and you drink water. That's about it when it comes to that. What medical errors are going on? Certainly those kinds of things happen all the time. Do specific diagnostic tests have to be given, or are they simply risk management type of issues? Is care fragmented? Are the doctors communicating with each other, or are they being provided with treatment that doesn't really help, but is done simply because that's the way we always do it? You'd be surprised at how often those kinds of things happen. Core problem 3, cultural content of care. Is information being given to clients in their preferred language? Is communication with patients limited, or is literacy limited? Or is there a deficiency in health knowledge? All of those things matter. Another thing actually goes along with preferred language is, well, do the patients, are they using their children as interpreters? You'd be surprised at how often that happens. That is terrible, terrible practice, though. Are religious, spiritual, and cultural practices being honored? And are they using complementary and alternative medicine? I always kind of cringe a little bit at the alternative medicine one, because you know what they call alternative medicine that's been proven to work? Medicine. Anyways, preventative treatment. Preventative treatment may be lacking in the following areas. Are wellness exams being done? Are at-risk factors not being addressed, such as smoking, obesity, lifestyle, substance abuse? Are chronic diseases being taken care of, such as heart disease or diabetes? And that might be the kinds of things that are leading to the problems that are bringing them to the hospital in the first place. Do they have their immunizations? All of those things are important parts of the preventative care, and they may be lacking. Okay, affordability and or access to care. If any of you have been to the hospital for any reason, you probably know it's really expensive to go to a hospital. And so you might want to look at areas, well, as financing available for people that need those medical supports, such as a hospital. Are there publicly funded programs? Are the patients of the hospital covered from private insurance companies? Those would be issues where the system might fail, or where policies aren't set up that would create further problems for patients. Mental health conditions. Are clients being screened for mental health conditions when they go into a hospital? A lot of times doctors will just completely forget that that's something that they've got to do. You know, they're looking simply at what are the physical issues, let's nail it down and solve it. And they forget that mental health issues may be creating some of the problems that they're facing, or it may be complicating some of the issues they're facing. Are mental health conditions being treated while people are hospitalized? You'd be surprised at how many people are simply just taken off of their meds when they go in for some sort of surgery, and then all of a sudden they wake up psychotic. Well, you got to make sure that they continue getting their mental health care. Is there follow-up treatment for mental health conditions after discharge? Are medications for mental health conditions being included in the treatment plan? Is mental distress stemming from health conditions? All of those things come into play in terms of where mental health starts to matter in acute care hospitals. Core Problem 7 of community-based healthcare discusses issues around whether or not the services that are provided at the hospital are relevant to the people that live in the local community. So is discharge planning addressing the family needs of the clients? Are there transitions between community-based levels of care? Will knowledge be shared from the hospital to the clinic where they get services? Are the services in the communities that they will be referred to appropriate? Will there be any kind of coordination? Will the home environment even be assessed to ensure that it's a good fit for the client as they are discharged from the hospital? So that's an example of how you might look for what are called red flags in any kind of setting that you might be working in. What you are looking for with red flags are the specific problems that would fall under any of those main core problems that exist across all of the 8 policy sectors that exist. So the red flags, again, they're specific problems, and they would exist at the micro level, at the meso level, and at the macro level. So a good way to think about this would be to look at school systems where kids are being over-medicated for things like ADHD and ADD. At a micro level, you might be talking to family members about, hey, make sure that your kids are getting the right kinds of services, that they're advocated for, and that they're not just being doped up. At a meso level, on the other hand, you might be looking at talking to school members, to other authorities within the school, to make sure that they're aware of the problem and that they are providing appropriate care. And at the macro level, you might be looking at talking to Washington, D.C. or your senator to see if there are specific FDA regulations that could be developed.